My name's Nalaka Gooneratne. I'm an associate professor here in the School of Medicine. I'm delighted to be with you here this afternoon. I'm going to be talking about some connected health solutions for insomnia. This is basically a pilot grant which we were fortunate to receive as part of the ICMAT Connected Health pilot program. From the point of view of a diagnostic entity, approximately about 5% of the population has insomnia. Now, because of the common prevalence of insomnia, there is an interest in exploring internet-based solutions for managing insomnia. And part of that is because of the issue of access and safety. There's only about 200 individuals who are actually board certified to do counseling therapy for insomnia. So if you can imagine, potentially millions of people with insomnia, 200 people is really not enough to actually manage that. And the other common therapy, which is sedative pharmacotherapy, is really not that effective and can have a lot of side effects as well. So there's also cost issues in the sense that it's about $1,000 to do a counseling session for insomnia, and it may not be covered by insurance. And internet-based cognitive behavioral therapy, which is an automated process, is clearly potentially much less expensive. There are a variety of platforms. Some of you might have heard of sleep.io, and also there's a NIH-funded program called Shut-Eye that recently went commercial. These are very convenient because they can be done at home on the patient's own schedule. And they create the opportunity of something called a stepped therapy approach, where one begins with an internet-based platform, and if that's ineffective, one might move to single-session consultations or group therapy or ultimately individual therapy. And in this particular study, the majority of patients, nearly 50 out of about 90, were effectively treated with the web-based approach initially. There are, though, some key challenges, and the main challenge is how do you encourage adherence? Are you also picking kind of a self-selective group in terms of the individuals who actually sign up for the web-based platform? And the efficacy data is limited because of a lot of conflict of interest in the sense that many of the people who create the platforms are the ones kind of reporting on their results, and they clearly have a financial interest in that regard. So while there's a lot of potential, there are clearly some challenges around this space. So in order to kind of address some of those questions, we asked ourselves if there are ways that we can sort of optimize an internet-based approach for insomnia management, and can we also introduce a method that allows us to monitor adherence using mobile device or smartphone technology. And our group kind of thought about this a bit, and we realized that mindfulness meditation might be a useful intervention to consider adding. For those of you who are not aware of it, it basically has many variants, but one form is meditation that focuses on breathing awareness. We then asked ourselves, is there some kind of physical gesture or activity that could then sort of couple with the smartphone and allow us to monitor adherence? And one idea was something as simple as an anchoring task that involves tapping your finger on the smartphone screen. And kind of the mechanism behind this is that from the point of view of insomnia, when some of us go to sleep, we have an increasing level of stress as we're thinking about our next grant application or our progress report or who knows what. And then that raises us above the insomnia threshold, at which point it becomes difficult to fall asleep. Our goal with mindfulness intervention is that by thinking about your breathing cycle and then tapping at the end of the exhalation phase, that reorients your attention. So it's hard to think about your upcoming conversation with your program officer and then at the same time remember to tap at the end of your breathing cycle. That sort of helps take your mind off of that a little bit. So we wrote a smartphone program to implement that, and then we ran it in a pilot study. And this is just the data from one subject. This is someone who had insomnia for about 5 years and came to see me in clinic and wanted a prescription for Ambien, which is sort of a classic pattern that I see. And the numbers are a little bit small, I'm sorry, but basically on her first night of using the application, she tapped on the screen about 225 times. That seems like a lot, but for any of you with who think about your breathing, that's about, you do about 10 breaths per minute, 6 to 10 breaths per minute. So that's not out of this world. It took her 65 minutes to fall asleep that night. The second night, she tapped about 142 times and reported taking 60 minutes to fall asleep. The third night, about 84 times and 25 minutes to fall asleep. And by the fourth or fifth night, she was just tapping maybe 10 times, and she was falling asleep in 20 or 30 minutes, for example. What's also interesting for me, and which sort of prompted this way to help the pilot application, was that she stopped doing it on nights 6, 7, and 8. Okay? But I knew she stopped doing it because I was able to check the application database, and I saw that she hadn't done any tapping or entered any data. So I gave her a call on this date, and I said, I noticed you haven't been doing it. Could you please start it back up again? And then she started doing it again, somewhat intermittently. But what you're basically seeing is that the amount of time it takes her to fall asleep is around 10 or 15, 20 minutes. And she's tapping, on average, about 15, 20 times. One night she tapped 94 times, but she reported falling asleep in 20 minutes. So overall, that's better than how she was doing when she first came in to see me. And we didn't need to give her any Ambien, at least in this particular patient's case. So that was quite interesting and promising, but it got me wondering about the question, is there some way that I can implement this without me having to pick up the phone and make a phone call if she isn't doing her therapy or his therapy? And so within that context, we put forward a wireless connected health application where we considered exploring different mechanisms to encourage adherence. In particular, we were interested in examining the effects of a regret lottery intervention as well as a social support intervention. And we put it together as a 2x2 design where subjects can receive one of these. They'll be divided up into 4 groups, with one group being a control group, which will just fill out a diary basically to report their sleep patterns. And we'll get some basic sleep hygiene instructions, the kind of stuff you can download from the internet, for example. Whereas one group will get both interventions. And our goal is to find out whether this, as implemented through the Way to Health platform, can actually improve adherence with this mobile device solution for insomnia without requiring personal intervention, thus allowing us to potentially keep costs relatively low.